Hey guys, what is going on? So today we'll be talking about what? Puberty. We're talking about puberty. Yes, I know already some of the changes that boys and girls go through during adolescence. I say adolescence, between 10 to 19 years, that period, or teens, changes that they go through. But beyond that physical that we see, they also have behavioral, social, emotional changes that they go through. So for puberty, normally in girls, what do we see? Changes in breasts. They start having hair in their armpits, and then in the pubic area, they start menstruating. They gain height. Some of them develop acne, and then you have widening of their hips. For boys, they change in height as well. Hair in their armpits and in the pubic area, voice changes. But beyond that, emotionally, socially, psychologically, they are changing as well. Their brain is rapidly developing. And some of the things you could notice, but it's not for all teens or adolescents, is that tendency to not want to listen to their parents, that tendency to want to take risk, that peer pressure to want to do what their friends are doing. So just for you to know that it is normal. So beyond the physical that you see, there are also changes that is going on within their brain that you might not know. But whatever they are doing during that period, trying to take risk, wanting to do what their friends are doing is absolutely normal. But how do we handle it as a parent? How do we handle it as guardians? So the first thing is for you to have that information, that knowledge, that during this particular stage, they go through physical changes, they go through emotional changes and psychological changes. And then you start the conversation with them early to prepare them. So when they are like 6, 7, you're already telling them at this particular age, like for girls 8 or for boys 10, you start noticing changes in your body, and it is normal. And then you also go further to tell them it's also normal for you to want to do what your friends are doing, and then wanting to listen to you as your parents and wanting to take risk, and also is for you to be impulsive, want to do things based on emotions. And then you give them the reason. The reason your brain is developing, that part of the brain that controls critical thinking and logical thinking is still developing. The development is slower than the emotional part of the brain. That's why you do things based on emotions. So when your parents, when we talk to you, try as much as possible to listen, because we've gone through that stage before, and then we don't want you to get derailed. We don't want you to do things that you regret in the future. So you start having that conversation with them about the physical changes, about the emotional changes, and if there are things that you feel you cannot handle, don't just keep it to yourself. Try as much as possible to speak to healthcare professionals that can help handle such situations. Just also note that it's not all adults that manifest this kind of. Some of them are very calm all through, but a majority of them tend to have that peer influence affecting them, doing things based on emotion. Basically, those are the things I just wanted to share with you regarding puberty. Just know that beyond the physical, we have social, cognitive, and emotional changes that they go through. So you have to learn to be patient with them, and don't think, oh, maybe they are possessed. No, just understand it's the state that they are in and learn how to handle them such that it minimizes rift between you and them.